Hi, I'm Dr. Ali Kohansal, a gastroenterologist and therapeutic endoscopist at Dalhousie University, Halifax, Canada.
And I'm Dr. Dennis Lim. I completed my core gastroenterology and therapeutic endoscopy fellowship at Dalhousie University, Halifax, Canada. So today we will be talking to you about a recent publication in iGIE about the clinical impact of delayed plastic biliary stent removal because of the COVID-19 pandemic. This is our 2-year retrospective study documenting our experience as a tertiary ERCP referral center in Eastern Canada. So, Dr. Kohansal, to start, maybe you could tell us more about what gave you the idea to conduct this study.
Sure. As we all know, COVID-19 pandemic was a once in a century event that had an extraordinary impact on the way we were able to deliver care to our patients due to the strain that was put on our healthcare systems. One of the impacts in the world of therapeutic endoscopy was limited access to endoscopy and having to delay procedures that were not deemed to be urgent or emergent. One such area was returning ERCP procedures for stent removals in patients who had had a plastic biliary stent placed during a previous ERCP. Um, Most of the guidelines, including in our institutions, recommended that we remove most stents within 3 to 6 months. However, the ideal time frame for stent removal or exchange has not yet been clearly defined, especially for certain conditions, such as incomplete clearance of common bile duct stones or very frail patients, or a combination of both. The time interval for a stent exchange must be carefully considered. The pandemic provided an environment where we could measure the real world impact of delayed plastic biliary removal.
Absolutely. And I remember when the pandemic hit, when we had to reprioritize all of our, even our semi-urgent cases, let alone elective cases such as stent removal, there were certainly a lot of cases that were delayed. Um, that being said, all we had without a proper study was anecdotal cases to review at M&M rounds. We really needed to conduct a proper study. And so we looked at the cases that we had done over a 2-year time frame. We were able to accumulate a total of 286 cases where single 10 French plastic biliary stents were placed. We divided these cases into stents that were removed before the 90-day mark and stents that were removed after the 90-day mark. When we compared the data, we didn't actually see any statistical difference in stent-related adverse events between the two groups.
That's interesting. During our study, one of our hypotheses was that in cases where the plastic biliary stents were placed for indication of common bile duct stones, there may be an increased risk of earlier stent occlusion and associated complications related to the biofilm formation related to the stones. Was that something that you found in your data?
So interestingly, while we did notice a numerical increase in cases, when we ran statistical analysis, there was no statistically significant difference between the two groups.
In your study, you only reported on 10 French plastic biliary stents. Can you comment on why that was?
So we certainly collected data on not just 10 French plastic biliary stents, but for example, 7 French plastic biliary stents, or in cases that also required not just one but multiple stents to be placed in a common bowel duct. The issue was that the numbers were so small for those cases that we could not really draw any meaningful conclusions. And so to avoid confounding our results, we ended up excluding these cases.
Interesting. So, Marta Freitas and her colleagues from Portugal also happened to publish a very similar study at a very similar timeline in the Scandinavian Journal of Gastroenterology. And in their case, they examined 120 cases, a third of which had delayed plastic biliary stent removal with a threshold of over 6 months after initial ERCP. And they also found no difference between delayed and non delayed plastic biliary stent groups. And that's useful because that also their results is complementary to the results of our study. So Dennis, as an early career gastroenterologist who was instrumental in this study as a primary investigator, how has this study impacted your practice?
So definitely through reading up on available literature on this subject and also reviewing our own cases, it has definitely changed the way I view follow-ups for stent removal. Firstly, in my individual practice on my EMR, whenever I place a stent, I do add these cases onto a list that I check every month. They only get removed from the list after I've taken the stent out. This is definitely a measure which I think is realistic for any ERCPist in solo practice to put into their EMR. If you were to work in a group and if you were just starting to come up with a stent registry, one option is to also go through the cases that have required a stent to be deployed with your endoscopy unit. This is a very practical way to firstly start off a stent registry at any center, just because every stent that is placed in the patient usually requires some charting and documentation after placement. And secondly, uh, I think patient education goes a very long way in terms of ensuring adequate patient follow-up. If you worked in a diverse population, such as a metropolitan city, which incidentally many ERCP centers happen to be in, language barrier is something that we have to consider. Educational printouts in different languages may adequately inform a patient and or their family members that a stent has been placed, the stent cannot stay in long term, and so there must be follow up to this stent. So, Dr. Kohansal, what would your key take home message be for our viewers?
So based on our data, it is safe to leave plastic biliary stents for up to 6 months before there is a need for stent exchange or removal. However, we have to keep in mind that our study is retrospective, and ideally our findings should be further validated through a large prospective database of ERCP patients.